Well, my talk summarised the importance of severe asthma, which, as you know, affects 5 to 10% of the asthma population, but consumes up to 50% of the European healthcare budget for asthma in total. And much of this consumption is related to unscheduled hospital visits and primary care visits due to exacerbations and asthma attacks. The current therapies that we have for asthma, which include combination therapies with inhaled corticosteroids and long-acting bronchodilators, as well as leukotriene receptor antagonists and theophylline, do not achieve control of disease in quite a substantial portion of patients with severe asthma. And the focus of my talk really was to highlight the importance of newly emerging biological therapies targeting important pleiotropic cytokines in the asthmatic airway, improving the lives of asthmatic patients. As an example, we previously identified the presence of asputamine eosinophilia in patients with asthma as being highly predictive of response to both inhaled and oral corticosteroids in asthma. Subsequent studies by our group, published by Ruth Green and subsequently by Jairam and Chomsky, identified that targeting sputum eosinophils in patients with severe asthma could profoundly reduce exacerbations compared to standard guideline-based approaches. We subsequently went on to identify unbiased phenotypes of patients with severe asthma using hierarchical clustering techniques. Notably, a group of patients with late-onset concordant eosinophilic disease had the presence of very few symptoms but significant inflammation in their airways, putting them at a very high risk of asthma attacks. Two subsequent therapy trials evaluating mepolizumab, a monoclonal antibody to IL-5, in this cohort of patients have subsequently identified the importance of asputamine eosinophilia in treatment stratification of this therapy in asthma. MEPO profoundly reduced exacerbations by up to 50% in patients with severe eosinophilic asthma, but had little impact upon lung function or standard asthma outcome measures, highlighting the importance in asthma pharmacotherapy of finding the right patient, the right target, and the right outcome measure.